I do, Mayor.
We're going to have you sit here with Dr. Randolph. Okay.
Hey everybody, we're about to get started.
So thank you all for coming today. Obviously we have a lot of interesting news to share. So without further ado, I would like to introduce Dr. Lysandra Hall.
Good afternoon, Dr. Lysandra Harris Hall, Deputy Chief Administrative Officer for Shelby County Government and serving as the Interim Director for Shelby County Health Department. We are delighted to have members of the media here to provide informative information to our citizenry. On behalf of the Health Department, I now introduce Mayor Harris and Dr. Bruce Randolph, our Health Officer.
All right. Well, very good. Good afternoon, everyone. I think the principal goal here is to sound the alarm around the transmission we've been seeing over the last several days, particularly with respect to the Delta variant. And so I think we're positioned to answer some questions, possibly after Dr. Randolph makes some remarks. But that's our main goal, is to make sure we're getting the word about the Delta variant. We've seen high numbers. And we want to make sure we're doing everything we can to push back on the increase in numbers that we've seen here in Memphis and Shelby County. So with that, I give you Dr. Randolph.
Thank you, Mayor Harris, and greetings to you who all are here, the media, and greetings to fellow citizens of Shelby County. I would like to just share with you some information. As you may well recall, almost a month ago to the date, we had a press conference, and at that time we were concerned about the Delta variant and the number of cases that we had, and at that time we warned that it was important that people get vaccinated and continue to adhere to the safety measures so that we do not go backwards, so that we continue to progress in a positive and forward downward decline. And so I'd like to just share with you, if I may, where we are today and why we are even more concerned. So we're actually reporting new cases, 183 new cases. And it's our belief that because that the Delta variant now in Shelby County is estimated to be approximately 72%, you could almost conclude that 72% of that 183 cases is a result of the Delta variant. Next slide. And so what we're also finding is that the positivity rate, that is of the number of tests that we performed as positive, is approximately 9% or 8.9%. Just to give you an idea, the 1st of July, the positivity rate was 2.9%. So in a matter of 2 weeks, 14 days, it has increased from 2.9 to 8.9%, 3 times the rate. Next slide, please. And when we look at transmission, we're currently reporting actually transmission rate, reproduction rate, should I say, is 1.52. Earlier, it was as low as 0.73. Again, more than twice, almost 2.5 times it has increased. And that means that this virus is being transmitted, and it is being transmitted upon and to those who are not vaccinated. And it is the younger population, ages 18 and to 24 and who has the highest transmission rates. Next slide, please. So when we talk about vaccinations, the question is, where are we? And as you can see, that only 42% of our total population have received at least one vaccine. And we only have 34.7% of our population that's been fully vaccinated. And so we have quite a bit of people who are vulnerable because they have not been vaccinated. The other thing is, the question may be, well, what about people who've been infected? We estimate that even when you include those who have been infected as well as those who have been vaccinated, we're only talking about 70% of our population that has been either fully vaccinated or infected, that may be. And when you consider that there is a segment of our population, children ages 0 to 11, who's not even eligible for the vaccine, which represents 16.8%, then we estimate that there's about 40% of the population that is still vulnerable. And that is because they're either too young or they are unvaccinated adults for whatever reason, and I think I'll stop there and allow you to ask some specific questions that you may have.
Dr. Randolph, do you have the latest on, I know on Friday there was 87 confirmed Delta cases. Do you have an updated total of where where we stand with that?
So our total cases to date is 203. That's sequence of cases and suspected cases.
200 suspected and
right.
confirmed.
Yes.
How fast are they coming in?
How fast they're coming in, you mean?
The Delta cases. How much are they going up each day of the new cases?
Oh, well, let's see. If you look at the fact that we're reporting our 7-day average, we're reporting 136 today.
Of Delta?
Of cases, just cases, right? Yesterday, it was 123. The day before that, it was like 117, right? And so, and if you assume that 70% of those are Delta, then that'll give you some estimate of what we're looking at in terms of the rise in the number of cases.
When you said 72%, is that as of late, as of in the last month, there's 72% have been Delta cases?
Well, that's 72% of the sequences. So of the specimens that sequenced, 72, actually 71.8%, 72% of those have been Delta. Actually, it's been estimated that the number of cases could be anywhere between 70 to 80%. But that's very important because nationally it's only 58%. So we have a higher percentage of cases that's due to Delta than the national percentage. And that's the reason why we are concerned, reason why we really want to emphasize to our fellow citizens, get vaccinated. That's the one weapon, that's the one solution to this problem, is to get vaccinated. Because it's really coming down to two choices. You either get vaccinated or you get COVID. Those are the two choices that you're faced with. And therefore, if you get COVID, then you risk getting severely ill and die.
Go ahead, Fox 13.
Thank you. Dr. Randolph, with most schools set to start within the next month, do you have any concern that the Delta variant will spread even more in our communities? And just, what are you doing to push back against a potential spike in cases then?
I mean, our message is the same to those who are the age to receive the vaccine, get vaccinated. The teachers and staff get vaccinated. Otherwise, protect yourself. Those measures that we have in place, wearing the mask, maintaining the social distancing, the 6 feet, avoiding the poorly ventilated areas, still work, and it works against the Delta, but we have to do it. And so that's my message. And yes, we are concerned, and we'll be monitoring the schools and their situation closely.
Dr. Randolph, how concerned are you with how quickly it spiked? I mean, I know it's not the most cases that we've averaged over a 7 or 14-day period, but just how quick, for example, that RT rate is going up just since the beginning of the month. What does that tell you with just how quickly?
Well, it tells me two things. One, it tells me that we are dealing with a highly transmissible virus. More so, and we've said this before, that it's even more transmissible than the other viruses, the alpha, the original, even the original. But also, I think what we're seeing too is the result of the holiday, 4th of July, people relaxing the safety measures, especially those who are not vaccinated, letting their guards down, stop practicing the prevention measures that we have in place. But the thing is that I want people to understand, when we look at these numbers, it is primarily due to the unvaccinated population. You get vaccinated, if everybody, we'd continued the road that we were going when we were vaccinating everyone, we wouldn't be facing these type of numbers.
Is there an update, sir, about, I know last week about 1 in 10 were vaccinated with the Delta strain. Is that, of these 203, is that about is that where we're at right now, roughly, with vaccinated versus non-vaccinated?
You mean in terms of the breakthrough?
Yes, those who have Delta that are vaccinated versus not vaccinated.
So the Delta breakthrough is about 18 out of that 203, which is about 8.9%, roughly 9%, yeah.
Dr. Randolph, when in the past couple months we've seen testing numbers go way down. Are we testing enough right now to have a handle on how quickly this is spreading?
Well, the thing is that the testing may not be a complete reflection, because it's probably only those who are really symptomatic who are getting tested. And as we know, with the coronavirus, as much as up to 40% of the people could be asymptomatic. So it is possible that what we're looking at is not the complete picture. So again, that's why I'm preaching, pleading, begging, get vaccinated.
So question for you. I know that you guys are sounding the alarm, you're concerned, but folks aren't getting vaccinated at the rate that we want. So when do you guys step in and start adding more stricter health guidelines and directives, and maybe possibly go back to some of these stay-at-home orders?
Well, I don't think we're at that part of the conversation yet. I think right now we want to sound the alarm and try to convince people to be vaccinated. Like Dr. Randolph said, the vast majority of folks that face negative, severe consequences are the people that are unvaccinated. We continue to push the message around vaccination. In fact, we'll be knocking on doors this weekend. So anybody want to tag along on this weekend, we'll be knocking on doors in Berkeley. We'll have Spanish speakers with us to make sure we deliver that message to Latino households. In addition to that, we're at the prison today, right? I think you were at the prison. Were you at the prison today?
Tomorrow.
So prison, okay, prison tomorrow. We're at the prison tomorrow. Again, trying to convince those vulnerable populations, prisons, Latinx households, et cetera, about the importance of vaccination. Because if we can make that case, then that will put some of these concerns to rest. I would also say that, and I just asked this earlier today, just as a reminder, local government cannot mandate the vaccine. So the Tennessee General Assembly, as they adjourned this last legislative session, they passed a variety of laws that will prevent us from mandating the vaccine in any way, even in sensitive cases like at hospitals or in prisons, etc. And so a lot of what we'll see is to raise awareness around the importance of the vaccine, and so we appreciate you all being here, because this is an important piece of that puzzle. If we can get more people to take the vaccine, then I think there won't be much concern.
Dr. Randolph, the vaccinated, you said about 9% are breakthrough cases with the confirmed or probable Delta cases. How about hospitalizations? Do we know where that stands? How many vaccinated people are ill enough with the virus to be admitted into the hospital?
No, we don't know those exact numbers, but we do know that hospitalizations due to COVID is increasing. And the majority, if not all, are due to unvaccinated people. But the exact number I can't give.
Brad is next.
Okay, you go, Jeff.
Oh, this is a slight departure, but I'm wondering if the health department got any feedback from the state yesterday that you are going independently of their recommendation to the rural counties on promotion.
No, we did not hear anything. No.
Dr. Randolph, of all the trends that you just listed, is it the transmission rate that's giving you the most cause for concern? Is there anything, because 1.52, that seems about the highest that I can remember in terms of the transmission rate, right?
That has been the highest since April 2020. Yeah, so it's been the highest. But the things that I tend to monitor is our 7-day new case, a 7-day average, along with the reproduction rate, are the two main things, and positivity rate. I think those three indicators gives you an idea of the transmission where we are. You know, hospitalizations and deaths certainly are things of concern, but that's a measure of the bad outcomes.
Yeah, and remember, I think around 4th of July last year, we also saw an uptick.
Mm-hmm.
So we're about 2 weeks outside of 4th of July, so there is a chance that this is a blip. But we still want to be in a position to raise the alarm, because these blips can pick up acceleration really, really fast. And so I think that's the goal here. But we did see an uptick at 4th of July last year. So.
What are the populations that are not getting vaccinated at this point?
Pardon me?
What are the various populations that are not getting vaccinated at this point?
Say, what are they?
Yeah.
The various,
Mm-hmm.
it varies. It ranges from my conversations and what have you, to range from young African Americans to white evangelical. It's a broad range of people that makes up, by some estimates, 30 to 40%. But you know, people have various reasons why. One of the things is there's a lot of misinformation out there. Our effort is to get out the truth and present it to the people. My position has always been, if you're going to make a decision, at least make an informed decision on the facts. And so that's what we're trying to get out. That's who we're trying to reach. We're realistic. We understand that there's some people who just, regardless of what you present, still may not receive the vaccine, but at least we will have done our job to at least present the truth, the facts, and then let people make an informed decision.
We have time for 2 more questions.
Are you seeing increased vaccine uptake in children 12 to 17?
I think roughly looking at our data here, let me just see that age group. Well, we don't have it broken down by that age. Hold on a second. Let me just
And while he's looking there, I'll just put a plug in to the Shelby County Health Department, which has really done a great job of promoting vaccine awareness among families and their children, the importance of protection. So Joan and Dr. Hall and others have worked with Shelby County schools on a childhood vaccination campaign, and you'll see the art associated with that campaign on billboards around the county. They are already up. If you want a list of those billboard locations, Joan can provide it. But the art is special to us, and we think it communicates well because it utilizes actual Shelby County school students. So it's Shelby County school students who are the face of the importance of vaccination. So take a look at those billboards. I think it's really good work as we continue to expand awareness around the importance of vaccine.
So to answer your question, is roughly 21.8%, 22% of those aged 12 to 15 have been vaccinated.
12 to 15
Ages 12 to 15.
have been vaccinated.
Right.
Can I ask, is there a thought about resuming the weekly briefing? It's hard to get information.
No, I think that's something we can take under advisement. I think the numbers were very low, and as you know, there weren't many questions. Right, there weren't many questions as we ended those briefings. But if there is a need for more information on a more regular basis, I think all of us are ready to make that happen.
Dr. Randolph, is there a point 2 weeks from now, 4 weeks from now? I know we're not at that point yet, like Mayor Harris was saying about restrictions, but is there, if this keeps going for 2 weeks, 4 weeks, or is that on the table? Is there a timeline you all thinking about?
Well, I mean, that's a policy decision, and as the health officer, I provide the data and the analysis, and it would be the policymakers that will determine that. And so I would defer that to the mayor in terms of deciding when it's necessary to do that.
Yeah, the best advice at this time is that we have to really rely on what we've already taught folks, and folks have really learned important lessons about how to stop the spread, and we've got to rely on that training in this moment to keep the numbers down. That's the best advice right now, and obviously we're always in a constant state of reevaluating, but the best advice so far is we've gone through a very intense period, but out of that intense period was a lot of learning around how viruses are spread, and now that all of us know all those lessons, let's rely on that, right? Let's rely on that built up muscle memory right now when we need it. And so it's reminding your friends and neighbors of the importance of vaccination, and it's also, if you decide not to get vaccinated, committing yourselves to wearing a mask and social distance, etc.
And really quick, do you know if you are vaccinated, what the percentage is against getting Delta variant?
Oh, and that's the good thing. This is why we emphasize and get vaccinated, because the vaccine is effective. Anywhere from 88 to 90%, 95% if you are fully vaccinated. And so there's no need to succumb to this virus when you can take some preventive measures, and most importantly, getting vaccinated would be the thing. One last thing I want to just say to the citizens, and especially those who are still hesitant, who don't believe that this thing is real, and for whatever other reasons, you have to ask yourself this: are you going to wait until children are dying before you're convinced that this virus is real and that you need to be vaccinated. Even in the state of Mississippi now, it's reported that they have several children in intensive care and 2 on ventilators. Are we going to have to wait till that starts happening in Shelby County before we're convinced that we ought to get vaccinated? And what is being reported nationally is that the patients who are getting infected are doing so at younger ages and are becoming more severe ill than before, and the transmission is quicker.
So we do have a hard stop at 1:30, so if you have any further questions, please email them to me or Chip or both of us, and we'll get you answers. So thank you for